7 reasons why Americans pay more for healthcare than any other nation. USA Today. Americans pay more for healthcare but don't get better results. Why? The blame goes well beyond insurance companies. Below are your comments. When I had my spine surgery, there was a $6,000 charge to rent the scope used for the surgery. I asked my surgeon about that charge. He told me that since insurance only pays him $2,000 for his 2 hours of time, he has to inflate the bill somewhere else. But he did say the regular rate to rent the scope was $4,000. So everyone is ripping off the insurance company, and the insurance company is ripping off the payee. NT. So essentially the primary reason my surgeon got into medicine was to get rich. Hospitals are for profit. Doctors, staff, nurses, etc. are for profit. Healthcare insurance companies are for profit. Pharma companies are for profit. Our government employees are for profit and are easily bought with lobbying money from the entities ident. A fight in 8 to 11. We know the system is flawed, but we are making millions of dollars and do not see a reason to chong it. Now we know the rest of the story. I wonder how far the public has to go to actually get it changed. Most of my life I did without medical insurance. I just could not afford it for myself, and did not work for an employer who paid part of the cost. I used emergency rooms as my health plan. I was divorced and had to carry health insurance on my son. And it was an effort to do that. The last place I worked did offer it. And I was galled of it. I had no dental or V-zone or drug, and had to pay into it for a 80/20ths plan. Now I am retired. At 78 and have Medicare. Which is the best plan I have ever had. I have always been aware of why many people think socialized medicine would be nice in the US. People say that would lower the standard of care. The for-profit system we are on, when compared to other countries, is already very low. I am guessing we have the medicine for-profit system merely to help the wealthy make more money. After lifetime of living with it, I do not see it changing. Our leaders are for sale to the highest bidders. And too many corporations and too many people make way too much to allow us either better care or cheaper. Insurance companies lobby legislature and gift judges to keep status quo. This is the way US works. Billionaires deciding what best for you. Turn on the nightly news and you'll see why Big Pharma is so big. Instead of putting dollars into R&D, or lowering the price of prescription drugs, their advertising budget must be outrageous. And yes, judging from election results, there are many Americans who still buy the idea that healthcare is a privilege, not a right. Public corporations, insurers, providers, pharma, report low gross margins. after executive compensation cost has been skimmed from the top. It is too high. Eventually, the entire U.S. healthcare system will collapse. The cost of services will exceed the revenue taken in. People will just stop paying for it. If I was Canada or Mexico, I'd start building medical facilities on the border to treat Americans as a secondary market. America really needs a national service. I think this article has laid out a fantastic description of the problems. But what is it going to take to put this genie back in the bottle? That is what needs to done. All 7 reasons can be reduced to one word: greed. Why did they leave out preventable chronic illnesses due to poor dietary and exercise habits? Smoking alone costs over $200 billion in healthcare spending. Plus, smoking causes almost $200 billion in lost productivity. The first line of defense in your healthcare cost is yourself. Take care of yourself first, do what you can do. Then if you get sick, you don't ever have to say I should have took better care of myself. The only reason is greed for the high price of medical care in the USA. Somehow forgot lawyers and defensive medicine costs. $22 billion profit UHC. Profit is not an administration cost. When you have infinite demand and limited supply, as in the case of healthcare, you have 2 choices. You can ration it by price, or by access. The UK and Canada ration healthcare by access. Wait times are significantly longer than in the US. Access to some therapies are either limited or not available. The US rations healthcare by price. If you can afford it, you can get most any treatment when you want it. There is no silver bullet. 7 reasons why Americans pay more for healthcare than any other nation, plus greed. As a former surgical practice administrator with extensive experience dealing with private insurance and Medicare, I think a single-payer system would be the only way to get healthcare costs under control. I am angry over the cost of my healthcare, but I am angrier with my government. Government does nothing to address the issues associated with healthcare. They spend countless hours looking into a laptop or a rigged election while neither benefits the common citizen. They also get large donations from the medical industry and pharmaceuticals when running for re-elect. The healthcare industry needs to be investigated in depth. A serious investigation into all of health care is needed. Reason 6. Americans pay far more for prescription drugs than people in other wealthy nations. Medicare and in the Medigap time for prescriptions. Which means I have to pay 25% of the actual medication cost. I'm a native German, now US citizen. In Germany there is no such thing as Medigap plus medications in general cost €10, a boo. $11. So here right now I pay $147 per mo for Xarelto, while in Germany I would pay €10 at any time due. Ring the year. The US has become my home in the last 40 plus years, but I do long for the social safety Germany gives its POP. The whole thing is a scam. I pay $1,200 a month for healthcare and pray I don't need to go to because that will cost me año. Their $8,500 the is for people on Medicare or welfare only. It sickens me every time I need to renew my healthcare. I know I'm underinsured but can't afford a NY thing else. Doctors order procedure after procedure after procedure because they are trying to not get sued, and this costs big money. But working class people will keep voting for Republicans who want to keep our healthcare exactly the way it is, when there are proven models in peer nations of better and more affordable healthcare. You can't fix you know what. After all the blame is assigned here, my guess is that most of the critics wouldn't want their medical issues attended to in a foreign country. Administrative costs can be fixed if computer systems can communicate between hospitals and insurance companies. This is not a technical problem. If the government is subsidizing public hospitals, it should require hospitals and insurance companies to design a system that works. It's easy to find the problems, fixing it is the hard part because doctors and hospitals are using the system to increase their income. Apples and oranges, the EU pays more income taxes and sales taxes that cover the cost of healthcare. Plus you are being sold a bill of goods that was set up by Medicare to be bid out to private insurers. They don't bid anything out in the EU to insurance companies? No, one reason, it's a rigged for-profit business. You don't even make medicine to cure anything anymore. You make it so we have to use it for our entire lives so you get rich off us. What else? Oh, the completely unnecessary surgery to once again make you more money. And let's not forget the infamous nurse practitioner appointments. I wonder why you allowed that one. Cash money bag, you are up for review, medical industry. It's time. 8. Malpractice lawsuits and the cost of insurance. 9. Because USA subsidizes reduced costs of meds to big pharma in other countries. 10. No cap on medical workers' salaries or procedures. MRIs and many other procedures are 10% of the cost of USA and other countries. 11. High cost of real estate for hospitals and office complexes. 12. Because of decentralized services and offices. In many countries, doctors have their practices inside hospitals. Please subscribe to my channel. And if you like it, please thumbs up.